Here we have a live shrimp. We're going to check for clinical signs. Right in the dorsal area, you will see the intestine all along the tail. And the intestine is full of food, showing very clearly. So it's an indication that the shrimp is feeding well. Now we are looking at the head area, the cephalothorax. We have the stomach, where it's pointing at the end of the forceps. Is the stomach. Also, the stomach is full, so it's a good indication that the shrimp is feeding properly. And then we have this large organ, that is the hepatopancreas, that is for storage of lipids, and also for enzymes for digestions. Also, we're gonna check for the gills. We're gonna open the operculum and show the branches of the gills. It looks alright, it looks like good coloration. There's no indication of melanization or bacterial infection or fungi. No problem with the gills. But we're gonna check later, in a wet mount preparation. Here we're looking at the Plio Pots. The Plio Pots are for swimming, and there are melanization at the end of the Plio Pot. So indication of a bacterial infection, or could be also caused by fungi. But most probably in this situation is a bacterial infection, probably a vibriosis. Okay, we're gonna turn around and look at the uropod, the tail. And we can see there's redness. There's also indication of stress. And also there is indication of erosion along the edge of the uropod. Also, it's an indication of a bacterial infection, most probably by a vibrio. And this is Plio Pots, the working legs. And also at the tip of the end, there's also melanization. You can see the black spots, indication of a bacterial infection. Also, we check for the texture of the exoskeleton, whether it's soft or hard. Of course, during the molting period, the new shell will be soft, but that's normal, so there's no problem. But in very short hours, it will get hard and become very firm and hard. So this exoskeleton should be always hard, unless it is going through the molting period. This is the first segment. Second, third segment, I'm gonna briefly touch and squeeze a little bit. Well, the touching the skeleton is very soft, and also it's an indication of sick or diseased shrimp. Well, the next step will be looking at the wet mount of preparation of the hepatopancreas.